Hi, I am Dr. Saqib Mansoor, and today I will discuss with you the mallet finger deformity. And this is, you see, this is the shown in the picture with the flexed finger with the damage to the extensor tendon has occurred. It has ruptured, or there can be avulsion injury as well, where the bone fragment is separated. So, moving on, tendon lesions and the finger deformities two have been uploaded on my YouTube channel, the dropped finger and the ruptured extensor pollicis longus. Today I will do mallet finger deformity, and then I will discuss bottom deformity and the swan neck deformity. So the mallet finger, it's shown you already. This is the finger. This is the position of the clinical appearance of the finger. This is held in this uh, flexion, the distal interphalangeal joint. Tendons, this is the anatomy. Tendons are the tissues that attach muscles to bone. The muscles that move fingers and the thumb are lying in forearm and hand. Tendons stretch out from these muscles through wrist and get attached to small bones of the fingers and thumb, allowing one to move them. Extensor tendons on the top of hand make straight fingers, that is the extended. Flexor tendon on the palmar side of the hand bend the fingers, right? So you could see this. These are the extensor tendons, the long extensors attached to the distal phalanx of each finger. This is that of the thumb. This is the same picture. And now, very important structure, the extensor expansion, right? It has three parts, right? This is the central part. Over here, the central tendon and two lateral bands, which gets converged to get inserted into the distal phalanx, the base of the distal phalanx. Mallet finger is an injury to slender tendon that makes tight the end joint of a finger or thumb. This joint is termed the distal interphalangeal joint of fingers and interphalangeal joint in the thumb, as there is only one interphalangeal joint in the thumb. It is also called baseball finger or the hammer finger. The injury can occur when an underlying solid or rigid object that is unyielding, for example, a baseball, hits tip of the finger or thumb and pushes it to bend more than it is projected to go its hyperflexion. Consequent to this injury, one is not able to straighten up tip of one's finger or thumb on one's own, as a resultant bent posture of tip of the digit. So let's see the picture. It's shown you already this. And here you could see the mechanisms, right? This is the clinical appearance of the mallet finger, and here's the athlete hitting the unyielding object, and this is the injury, the ruptured tendon, and this is resulting in the mallet finger deformity. Here you could see this. This is a ball, supposed to be a baseball, and the finger hitting that, and the rupture of the tendon occurs, extensor tendon, which is very slender and tiny, and it ruptures. It can be avulsed as well with a bony fragment. In mallet injury, an object hits the tip of the finger or thumb. Force of blow produces a tear close to the insertion of the extensor tendon at distal interphalangeal joint of the digit. Despite the fact that force to produce this injury is characteristically large, a minor force, for instance, tucking in a bed sheet, can at times produce a mallet finger. So mallet injury can either rupture middle of the tendon or tuck the tendon away from place where it attaches to the distal phalanx. Here you could see this is the extensor tendon rupture. In some instances, a tiny piece of bone gets pulled away along with the tendon. Here you could see this. This is the avulsion injury. This is known as avulsion injury. At times, this avulsion fracture can be fairly large and produce instability of the affected joint. In those cases, surgery may be required. This is same picture. Long ring and pinky fingers of the dominant hand are most likely to be injured. Nevertheless, any digit can have a mallet. Symptoms: the finger is commonly painful, bruised, and swollen. Fingertip droops markedly. Fingertip straightens only passively. So, risk for infection. It is very essential to seek out instant attention if there is any blood underneath the nail or if nail gets detached. This can be an indication of a cut in nail bed or that the phalanx is broken and the wound extends down to the bone, an open fracture. These kinds of injuries put one at danger of infection. So the first aid: to alleviate pain and decrease swelling, apply ice to patient's finger instantly and place his hand raised above his heart. Acetaminophen or NSAIDs, non-steroidal anti-inflammatory drugs like naproxen or ibuprofen, may help to reduce the pain. A well-padded splint for the tip of his digit can be applied, but be certain that the splint is not that long that it inhibits movement of uninjured joints. Patient must get an evaluation with the hand surgeon immediately, preferably within a week after the injury. So, how the doctor examine? Doctor examination. A mallet finger injury needs medical treatment to make sure that the finger gets back as much function as possible. Majority of doctors suggest seeking treatment within a week of injury. Nevertheless, there are cases on record when treatment was late for as long as a month after injury and the finger still healed totally. So the physical examination: after your medical history and the symptomatology are discussed with the doctor, he will examine your finger or the thumb, as the case may be. During this examination, the doctor will hold affected finger and ask you to straighten actively on your arm. This is known as mallet finger test. Here you could see this. X-rays. The doctor is most likely to order X-ray of the injury. This is the X-ray, and this is the distal phalanx. This is the proximal phalanx, the middle phalanx, bone fragment. Right. This is separated or avulsed. If a fragment of a distal phalanx was pulled away when tendon got ruptured, or if there is some other bigger fracture of the bone, it will be visible in an X-ray. The X-ray will also demonstrate whether the injury pulled the bones of the joint out of the alignment, which may need surgery to fix. What's the treatment? If not treated appropriately, mallet finger injuries characteristically cause stiffness and deformity of injured fingertip. In the worst cases, untreated mallet finger can cause significant deformity and reduced function. This is the swan neck deformity, which is in fact reverse of this condition. Nevertheless, if treated immediately, most of mallet finger injuries can be treated without surgery by applying a splint. So this is a swan neck deformity development. Opposite to that is the bottom deformity, reverse of that. In kids, mallet finger injuries can involve cartilage that controls growth of the bone. The doctor must cautiously evaluate and treat this injury in kids so that fingers does not become stunted or deformed. So most of mallet finger injuries can be treated without surgery by applying a splint. That is the catch. Non-surgical treatment. Majority of mallet finger injuries are to be treated with splinting. A splint holds the fingertip in extension till it heals. Here you could see this. This is the application of the splint to get it straight into the position of extension. I've shown you already. Non-surgical treatment continues. The splint has to be worn full time for a span of 6 to 8 weeks for restoration of function of the finger. This implies that it has to be worn even while bathing, then changed with when care afterwards. With a lot of care, even then it is being changed, and you have to keep it extended with the help of the other hand. Nonetheless, splint may be removed or taking a bath if distal interphalangeal joint finger or the interphalangeal joint of the thumb is held in extension with the other hand for the whole time the splint is off. If fingertip droops a little, healing gets disrupted, and you will have to wear the splint for an extended period of time. As wearing a splint for a lengthy period of time may cause irritation of the skin, the doctor may talk with you about how to check your skin for problems carefully. The doctor can also schedule extra visits over the course of 8 weeks to monitor the progress. Here is this: while removing splint for cleaning and drying, fingertip must stay in extension. Here you could see this. This is removed, the splint, and the fingertip is straight in extension. Non-surgical treatment continues. After 3 to 4 weeks of initial splinting period, the patient will slowly wear splint less frequently, possibly only at night. Splinting treatment generally results in both satisfactory function and appearance, though numerous patients are unable to regain complete fingertip extension, right? For a few patients, splinting regimen is quite difficult. In such cases, doctor may insert a temporary pin across the distal interphalangeal joint to keep it straight for a period of 8 weeks. This is, you could see, temporary splint applied with two pieces of tape. This is one tape, this is two tape. This is the way with it applying it. One tape is applied over here proximally, and this other tape distally to keep the fingers straight. So the surgical treatment. The doctor can consider a surgical repair if there is a big avulsion fracture fragment or if the joint is subluxed, the subluxation of the joint that is out of the line or alignment. In such cases, surgery is carried out for repairing the fracture and to realign the joint by use of pins to hold the pieces of bone together as the injury heals. Surgery can also be performed if the patient is unable or unwilling to get splinting for 8 weeks. Of course, a pretty long period of time. Pinning of the joint straight behaves as an internal splint. Nonetheless, this has an increased risk for complication with the surgery. So surgical treatment, it's another technique which is Fowler tenotomy. It is a surgical method that adjusts balance of extensor mechanism in the hand to treat chronic mallet finger if conservative techniques are not successful, which occurs rarely. It detaches extensor tendon to release the contracture. So in the last outcomes, in spite of treatment, majority of patients with mallet finger injury have a good outcome when treated properly and promptly. So I thank you very much. So stay tuned for the more finger deformities to come very soon. And till then, it's a goodbye from me. Take care.